Before we begin, please know that some episodes include language that may be sensitive for some people. Thank you for joining me for another episode of The Birth Portal. My name is Connie. Today's true story is about a woman I'll call Sydney, who had a previous cesarean section 2 years before. She did get fully dilated, but her baby never came low enough in the pelvis and vagina to try forceps or vacuum to help with the delivery. Sydney had been pushing well for about 2 hours, and the baby did not come down at all, so it was recommended that she had the baby by a cesarean section. She was really disappointed, but agreed. The doctor spoke to Sydney and her partner Steve afterwards and said everything went well, but there was no way that baby was coming out vaginally. However, she could try for a VBAC, which is a vaginal birth after a cesarean section. It is strongly recommended to keep 18 to 24 months between deliveries to allow the uterus to heal. The risk of the uterus rupturing is much higher if a vaginal delivery is attempted before 18 months. Well, 24 months later, Sydney returned to midwifery care, and we had several conversations reviewing her previous labor and went through the operative report, which reveals no contraindications to having a TOLAC. A TOLAC is a trial of labor after a cesarean section. An example of a contraindication would be like if there was an extension in the incision that was made in the uterus, where it tears down towards a broad ligament or cervix. Or another contraindication would be if there was a serious infection that developed in the incision of the uterus. Sydney was in the clear with no contraindications. However, the fact that the previous baby only got in the pelvis a short distance and never descended despite good maternal pushing efforts meant that the odds were not in her favor for this baby to be born vaginally. Sydney asked what could she do to increase the likelihood of a vaginal birth, as she really wanted to experience that. Some people think, why would you want to experience the pain of childbirth? I personally remember being excited about what would labor feel like. What would it feel like to have a baby come out of my body? We talked about diet and exercise so as not to grow a huge baby. We talked about laboring in upright positions and pushing also in an upright position as opposed to lying on her back. Sydney and Steve went home to think about it, and when they came back for their next clinic appointment, they thought, yeah, let's give it a try. So we made a plan that when Sydney came in labor, we would start an IV with a lure lock, so she has more freedom to move without pulling a pole and an IV bag around. A lure lock is attached to the plastic catheter that is inserted into the vein, and it is about 8 inches long with a cap on the end that can quickly be removed and attached to the IV line if needed. Continuous monitoring of the baby's heart in labor is also recommended during a TOLAC. There have been some women whose uterine scar had dehisced or ruptured without knowing early enough, and the baby's blood and oxygen supply was cut off. With continuous monitoring of the fetal heart, that would be identified almost immediately if it was to happen. And finally, supporting Sydney in labor, suggesting staying upright as much as possible throughout labor and the second stage of labor, which is the pushing stage. Sydney's first labor was about 6 hours, so we optimistically expected a shorter labor this time and hoped she would arrive to the hospital close to fully dilated. Sydney went into labor on my weekend off, but I stayed on to be with her, feeling a sense of excitement. When I saw her walk on the labor and delivery unit, she was smiling, not a bead of sweat to be seen on her forehead. She's not in labor, I thought to myself. Sydney had a contraction, and I felt her belly. It was hard, all right, but Sydney was not in much pain. She was standing straight with a smile on her face. We can sometimes tell the strength of a contraction by giving the uterus a bit of a squeeze through the belly. A mild contraction will allow you to squeeze deeper, whereas a strong contraction, the uterus is so firm that you can't push the tissue in. The uterus is a muscle, so imagine a strong contraction is like when you touch a strong flexed bicep. And when the uterus is relaxed, it's like a relaxed bicep muscle. We go into the triage area to check Sydney's cervix to determine if we'll admit her in labor or send her home. Well, to everyone's surprise, She was 8 to 9 centimeters dilated, and the baby's head was low in the pelvis. We quickly moved to a room on the labor and delivery unit and put the electronic fetal monitor on. And the baby was very happy, but she was having contractions every 2 to 5 minutes, and they were only lasting 30 seconds. Ideally, the body needs contractions every 2 to 3 minutes apart, lasting 45 to 60 seconds, and are painful in order to get to full dilation. We talked to Sydney about a couple of options. First one was nipple stimulation, which means pulling on the nipples, kind of like a baby nursing. Oxytocin is the hormone the body produces in the brain, and it makes the uterus contract. Breasts make and hold milk in grape-like sacs that also contract to release the milk. By stimulating the nipples, it can cause the release of oxytocin from the brain and make its way to the receptors in the uterus, causing contractions. The other option was to rupture her membranes. Sydney wanted to try option number 1. So every 2 minutes, she tugged gently on her nipples, which stimulated contractions. After approximately 1.5 hours, there was no change in her cervix, and Sydney asked to have the bag of water ruptured. The next contraction, after rupturing the bag of water, Sydney was hit with a contraction that now caused beads of sweat to form on her forehead. She lost her smile and was now groaning throughout the contraction. "Great sound, Sydney. Let that energy out. Let the sound be low and deep." I would often join a woman and show her how low and deep to go vocally. Low-pitched sounds help the body relax more, causing less pain and speeding up the labor, compared to high-pitched sounds that can slow the labor and cause contractions to be more painful. Steve is just so excited and supportive, but very concerned at the same time, constantly asking, "Is the baby's heart rate okay after every contraction?" 15 minutes after breaking the water, Sydney spontaneously starts to push, and the baby's head was coming down, but it wasn't low enough yet. I asked my backup midwife to find me a birthing stool, which we put beside the bed. We asked Sydney if she was feeling any burning sensation at the site of the uterine scar. "Nope," she says. Burning could mean that the scar is dehiscing or rupturing. After about 15 minutes of pushing on the birthing stool, the baby's head was visible. She moved to the bed and chose to lie on her back, and with the next contraction, Sydney grabbed behind her knees and pushed really hard. Steve saw the head and let out a sound of excitement that filled my heart with joy for both of them. "You're definitely going to have this baby vaginally, Sydney." "Really?" Steve says. Every time Sydney would push, Steve was pushing too, red-faced and all. I even caught myself pushing from time to time. After the next contraction, I guided Sydney's hand down to feel the top of the baby's head. She released tears of joy, eyes wide open in disbelief. The baby's heart rate should be somewhere between 110 and 160 beats per minute. And this baby's heart rate was often dipping below during a contraction and slowly coming back up to 120 beats per minute. After about 10 minutes, the heart rate was taking longer to get above 110, and I felt the baby needed to be born very soon. I asked that the bed be raised so I could better position myself, and suddenly we heard smash! The edge of the metal delivery table with all the instruments was too close to the bed, and the edge got caught and flipped everything onto the floor. Then the next contraction started, and I say calmly but matter-of-factly to Sydney, "Your baby needs to be born now as the heart rate is staying low." She gives the biggest push and the head is born, but I feel there's a tight cord around the neck and I need to clamp and cut it immediately. After that, I say, "Go ahead, give me another big push," and the baby is born. We had to stimulate the baby to breathe by rubbing her with a cloth and the bottom of her feet. She didn't like that and started to scream and cry. After about 10 seconds, I lift the baby up so Mom and Dad could see her, and in unison they say, "It's a girl! It's a girl!" Dad looks at me and mouthed the words, "Thank you," tears spilling from his eyes. It's so exciting to see a woman having a vaginal birth after cesarean section. Thank you for joining me for another episode of The Birth Portal.